This is the 15th annual Gathering Symposium for Faith, Health, and Community. The gathering is a convening or coming together of individuals and partners for strength and unity to educate, dialogue, and engage to address disparities in partnership with communities of faith. This event is sponsored and hosted by the University of California, San Francisco, UCSF, Helen Diller Family Comprehensive Cancer Center, Office of Community Engagement, and the Community Advisory Board's Faith Communities Committee, Abundant Life Health Ministries Network. The Faith Communities Committee leadership, Wilma Batiste, Chair, Marian Harris, Co-Chair, Dr. Corinne Holder-Jackson, Co-Chair, Pastor Anadele, Advisor, Vonda Nolan, Advisor, Gloria Brown, Founding Chairperson and Advisor, and Michelle Mosley, UCSF Office of Community Engagement Staff Liaison to the committee. Today's program presenters include Wilma Batiste, Gloria Brown, Dr. Jonathan Butler, Gigi Crowder, Dr. Cheryl Ewing, Marian Harris, Dr. Corinne Holder-Jackson, Carla Keener, Dr. Nainika Palmer, Dr. Kim Rhodes, Deborah Roberts, Dr. Valerie Yerger. The program will also include video remarks, a tribute and memorial recognition, video testimonies, and a marketplace of community resources. Engagement tips for today's webinar. Take notes. Refresh and drink water or refresh with a stretch. Try to move your body for 1 to 2 minutes every hour. Practice the 20-20-20 rule or principle. That is, every 20 minutes, look 20 feet away from the screen or your device for 20 seconds. And this will help minimize eye fatigue and strain. Ask questions using the Q&A box. Visit the marketplace of resources. Complete the evaluation form. And please share information and resources with others. Continuing education is available and provided by the Bay Area Black Nurses Association. You must be present for the entire event in order to receive credit. Please follow the instructions on the screen in order to request continuing education credits via email. Next up, Dr. Jonathan Butler of UCSF, and also with affiliations at Third Baptist Church and the San Francisco Faith-Based Coalition. To learn more about Dr. Butler, please review his bio in the Gathering program. Dr. Butler will help us center our heart, mind, and spirit through prayer and an inspirational word or reflection. Dr. Butler, you're up next. Please proceed.
Thank you. Our faith is calling us from the sideline to the front line. Don't you hear it? Don't you see it? Not to watch something happen, but to make something happen. Our faith is calling us not to think about it, but to be about it. Our faith is calling us not for quiet acceptance, but constructive resistance. Our faith is not calling us by iPhone or Android or iPad or text or Instagram or tweet, but our faith is calling us to meet the challenges that we face in the streets. Our faith is calling us to get on top of all this madness so our progress will not stop. We don't need you to act like you've been called, but we need you to come because you got the call. Our faith is calling you and me too. Will anybody answer the call? My brothers and sisters, we are in a mess in this world. What are we going to do about it? We need to remain active and hopeful in the face of collective misery and societal neglect, in the face of others thinking that we are still 3/5 of a person. When leaders don't feel as though our Black and brown children can learn, our faith calls us. When we are at the top of every negative statistic, we need to speak up against all injustices of society, but our speaking must be followed by action. And we need to hold folks accountable when they are one thing, when they say one thing, but they do another. Our faith calls us. It's easier to lie with your words than your actions, because what you do strongly correlates with what you want and what you believe. Jesus said that the Spirit of the Lord was upon him to bring good news to the poor, proclaim release to the captives, recovery of the sight to the blind, to let the oppressed free. Jesus matched his words with actions. Faith without works is dead. It's a great tragedy, my friends, that we live in a world and have always lived in a world where we profess certain values and lofty ideas, but on the other hand, we practice the very antithesis of our values. Our lives are characterized by a hypertension of creeds and a hypotension of deeds. We say we want justice and equality for all, but we keep our Black kids out of certain schools. Our Black communities are not provided with the fresh water due to limited resources. MLK says the strange dichotomy is the agonizing gulf between the ought and the is. And it presents this tragic theme of humanity's journey on earth. Our faith is calling us together, friends. And like never before, we need each other to come together to work the one who sent us. As the Holy Writ says, it's better to have a partner than go at it alone. Share the work, share the wealth. And if one falls down, the other one helps. But if their help is no help, it's tough. Two in bed warm each other, alone you shiver all night, as the word says. And so in the words of Robert Bass, it takes two to make a thing go right. Without Batman needed Robin, Tom needed Jerry, Mario needed Luigi, Scooby-Doo needed Shaggy, Ben needed Jerry, Bugs needed Daffy, Kobe needed Shaq. We all need each other. Bunny needed Clyde, Starsky needed Hutch, Homer needed Marge. Peanut butter goes with jelly. My brothers and sisters, we have to do this work together. We cannot do this work alone. Nobody reaches their goal or dream by themselves. And so our faith propels us to come together out of our silos, come together and engage with other people. That if you have a goal that you can reach by yourself, it's too small for you. And so my brothers, I implore you, I want to inspire you to work together, work with each other, work in collaboration, because that's what our faith calls us to do. Let us pray. God, we thank you for this day. We thank you for the privilege of being able to be together one more time. Life is never easy. Every now and then we face emotional and physical challenges that make us feel hopeless or that our future is bleak. But the Bible reminds us that we can cast our cares and anxieties on you and that you care for us, that God, you hear our prayers. That is why whatever prayers that are for health and healing that we have, we can always bring it to you. And so we thank you, oh God, for every person that is and will be on the Zoom call today, for each mind and heart that feels the presence of this space. We thank you. Only you truly know what we are setting out to accomplish today. We have an idea, we have a vision, we have a plan, we have many talents and abilities and time to work. However, only you can see in perfect detail the end and every beginning, every project, every season, every life. Nothing is ever in vain, for even the mistakes and missteps are used for our good. So we thank you, oh God, that we have the faith in knowing that you will provide us strength and confidence, that you would give to us what it is that we need. So bless this meeting conference, all those that are presenting, as well as the lives of those we will encounter after it. Ready us to make every moment count. Send your creative spirit upon us. Open up our hearts and to recognize your presence among us. Give us patience to listen openly without prejudice. Give us confidence to discover and explore new possibilities. Give us wisdom to discern what is right and what is good and just. Give us courage to participate in our ongoing work of creation, and that every move that we make, every step that we take, every breath we breathe, every thought we think, every sound we hear, we pray that it will be blessed. Amen.
Thank you, Dr. Butler, and let the church say amen. I am Wilma Batiste, chair of the UCSF Faith Communities Committee and the Abundant Life Health Ministries Network, and health ministry leader for Neighborhood Baptist Church in San Francisco. On behalf of Sister Marian Harris, co-chair, Dr. Corinne Holder-Jackson, co-chair, Pastor Tony Anadelli, and Sister Vonda Nolan, the Abundant Life Health Ministry Network welcomes you to the 15th anniversary gathering, Symposium for Faith, Health, and Community. We are blessed to have you join us. Next, we will share video messages. Please proceed with the videos. Hello, my name is Wilma. I am proud of the Abundant Life Health Ministry Network's accomplishments made since 2005, especially the gathering, an annual health symposium. We are celebrating 15 years today of building strong collaborative partnerships with communities of faith and sustainable health ministries in activities to help cancer inequities and disparities. Outreach that educate health and cancer awareness across counties, states, and other countries. Thank you for the opportunity of serving as your chair.
Greetings to my dear Abundant Life friends. On this 15th anniversary of the UCSF's Abundant Life Health Ministries, and as one of its founders, I would like to say how thrilling it is to look back on all that has been accomplished and to pay tribute to the visionaries who made it possible. First and foremost, my dear friend and mentor, Priscilla Jane Banks, is the person who brought giants like Dr. Frank E. Staggers Sr. to our table. And it was Dr. Staggers who first said, "We need a faith committee." And Ms. Gloria Brown is the one who created our health ministry focus. That it has grown and evolved is thanks to Michelle Mosley, Wilma Batiste, Dr. James McCrae, Marion Harris, the late Pat Coleman, and many more. And I thank Dr. Rhodes for keeping it going. I'm eternally grateful to have had the honor of contributing to this life-saving endeavor.
Good morning, Abundant Life. Thank you for inviting me to your 15th anniversary. It has just been a pleasure to have a front row seat to witness the progress that's been made from infancy to now adulthood. We just started as an initiative, meaning, hey, let's just try this out. Then we moved to project status, which means, hey, look, in my language anyway, it means come, sit a little while with me. And finally, at our 10-year milestone celebration, we were acknowledged as a full Loan Program, held within the Office of Community Engagement at UCSF's Ellen Diller Family's Comprehensive Cancer Center. We did that together. To each of you who have labored to make this possible, I would like to offer my sincere gratitude for your work. I know that our Father in heaven will greatly reward you for embracing the challenge of taking care of his people, our people. To each of you, only the best. Thank you so much.
Greetings. My name is Dr. Marcus Lorenzo Penn, and from 2006 to 2012, I served as the coordinator of outreach through the UCSF Radiation Oncology Department, headed by Dr. Mac Roach at the time. My involvement with the Faith Communities Committee and the Abundant Life Health Ministries Network began at their inception, working in those early meetings at Jones United Methodist Church in San Francisco, my home church actually, where we had the original vision of abundant life, actually come under the suggestion of Pastor Stacy Curran. I also remember the days of pounding the pavement, knocking on doors, and strategizing with my partner in time, Wilma Batiste, as we spread the gospel of the Abundant Life Health Ministries initiative. Lastly, I'll also just share how proud I am of all the committed individuals and organizations I have the opportunity to work with. Rena Pasick, Mac Roach, Priscilla Banks, Michelle Mosley, Wilma Batiste, Dr. James McCrae, Stacy Curran, Bishop Bob Jackson, Bishop Jerry Macklin, Michael Shaw, Arnold Perkins, and our late, great Dr. Frank Staggers Sr., and so many more. The fact that we're celebrating 15 years is a true milestone of passion and vision of all those involved to get us here today. I celebrate all the work that's been done, and here's to 15 more great years.
Gloria, and greetings to each of you. I served on the first CAB Advisory Committee. As the committee discussed avenues to reaching our communities of color, I felt that one way of reaching the African American community would be through our faith channels. At lunch one day with Dr. Rena Pasick and Dr. Frank Staggers, the conversation continued. And about midway through the lunch, Dr. Staggers said, "Gloria, you will chair the faith committee." Of course, I was startled and in disbelief, and felt that I wasn't really ready to take on a chair role. But who says no to Dr. Staggers? So I accepted the challenge and served as chair for several years before Wilma Batiste took over. And as you all well know, the rest is history. I am so very proud of the accomplishments of the Faith Committee and the work that's been completed and will hopefully continue. It's just outstanding. Congratulations again. I'm also very proud of being the first recipient of the Abundant Life Health Ministry Visionary Excellence Award. This meant and means still so much to me as I think about the work of the committee. My late husband and I always felt the need, and it's our responsibility to give back. And we have given back to the health ministry program with a monetary contribution to those congregations that have outstanding outreach programs and have really addressed the needs of our African American community. Again, congratulations to all those churches. I look forward to continuing our commitment in this area. So in closing, my best wishes to each of you. Congratulations to each of you, staff, volunteers, and other outreach partnering organizations. It's a community, it's a village, and that's what makes it work. Over the last 15 years and years to come, I thank you for this opportunity, and I look forward to staying in touch.
Hello, my name is James McCrae. I would like to thank the Abundant Life Health Ministry Symposium leadership team, as well as its predecessors, who have not only kept the vision alive, but given it wings. On the wings of commitment and the community formed, the call to create partnerships between the health community and the faith community has impacted individuals all around the 5-county Bay Area. Thank you. Thank you for your labor. Thank you for your service. May this year's symposium build our faith and magnify our will to erase disparities in the health field. Thank you.
Good morning. My name is Dr. Corinne Holder Jackson, and I am the co-chair of the UCSF Cancer Center Faith Communities Committee and Abundant Life Health Ministries Network. The video messages brought back so many memories, and seeing people that I have been so blessed and honored to get to know and work with over the past 15 years. At this time, we will now present a very special award named in honor of our Faith Communities Committee and Abundant Life Health Ministries founding chair, Gloria Brown. The Gloria R. Brown Visionary Award and the Leadership Award co-named for 2 health ministry leaders, Wilma Baptiste, current chair, and Marian Harris, my fellow co-chair. They each so deservingly were the first ever award recipients and fully exemplify what this award entitles. Now I'll turn it over to Gloria Brown for remarks and to present this wonderful award.
Thank you, Corinne. And hello, everyone. And thank you for joining us this morning. I am Gloria Brown. Wilma, Marian, and I are humbled to have been awarded the Abundant Life Ministries Award and being its first recipient. It gives us great pleasure to present this award along with a financial incentive to a well-deserving individual who fosters the development, growth, and sustainability of health ministries and nonprofits. She is a creative, innovative person with original ideas and uses her knowledge and experience along with the highest regard for community insight and wisdom, plus a keen focus on empowering and equipping individuals and organizations to excel. She possesses the traits of an exceptional leader, attracts and develops leaders, uses discernment to know when it is time to follow. She has vision and multiplies effectiveness. She has over 25 years of experience in organizational management, consulting, training, and facilitating, and executive level community grant funding administration. She is a sister friend, mentor, and consultant to so many of us. During this ongoing COVID-19 pandemic, the San Francisco Foundation Faith Program and the Bogan Group, LLC, have provided faith and nonprofit communities with resources to pivot during the and beyond COVID-19, including the development of a training and technical assistance series called the Masterclass Thrive from 2021 to 2022. The series draws on the expertise of master trainers locally and from across the country to guide the growth and development of faith-based and nonprofit leaders. The Thrive Faith Masterclass series includes a live interactive resource toolkit comprised of recordings and resources. The recipient of the Visionary and Leadership Award for 2022 15th Annual Gathering is Mrs. Carmen Bogan, CEO of the Bogan Group, LLC. Keeping with Carmen's quotable sayings, it's time to thrive and dream on. Join us in honoring and congratulating Carmen with the Visionary and Leadership Award. Carmen, please accept this award and provide remarks at this time.
Wow, thank you so much. I am so honored, and seeing Gloria Brown, I don't know why it choked me up, but it made me think of all of the work that she has done in so many communities. I first want to just tell you how much this moment means to me and that I never expected it. I want to show you this award. It is absolutely gorgeous. So gorgeous. I'm being honored by organizations that are close to my heart. The UCSF Helen Diller Family Comprehensive Cancer Center Office of Community Engagement, and Abundant Life Ministries. I'm especially touched because this inaugural award is named for 3 extraordinary Black women that I have admired for nearly 2 decades. My colleagues, my friends, my sisters. Gloria Brown, the icon, mover, and shaker. Wilma Batiste, the dynamo. And Marion Harris, the professor, the legend. Wow. But let us not forget other women standing here. Dr. Kim Rhodes, my friend Dr. Corinne Holder Jackson, Michelle Mosley. Wow. I also want to give a shout out to a pioneer of this gathering, my big sis, Priscilla Banks, and many, many more. Thank you. Most people don't know that I began my career in Los Angeles as a corporate management consultant with clients who were titans in their industries, such as the Getty Trust, Times Mirror, H.F. Amundsen, and others. I tell you this because while these organizations had a great impact on the world and still do, I never felt that my work in this arena touched the lives of those in my community, or that my presence really made the impact that I wanted to make. After participating in the work of faith-based and nonprofit organizations, that was all changed. And as Dr. Butler said so beautifully, my faith called me. These nonprofit and faith organizations touch lives of individuals and communities daily in a mighty way. And they often go unsung. But when we look in our streets and we see the need, we look in our schools and we see the needs, even when we look within our own churches and we see the needs, we can see that these are the organizations that are making a difference and will make a difference. This path has blessed me with the opportunity to dispense a portion of the grace that God has given me and to be refilled with it continually. The prophet Isaiah delivers a message from God describing the profound impact of the work we do in service to those who are often overlooked or forgotten altogether. Moreover, it tells of the profound impact the work does in us. In chapter 58, it says, "If you extend your soul to the hungry and satisfy the afflicted soul, then your light shall dawn in the darkness, and your darkness shall be as the noonday. The Lord will guide you continually and satisfy your soul in drought and strengthen your bones. You shall be like a watered garden and like a spring of water whose waters do not fail. Those from among you shall build the old waste places and shall rise up the foundations of many generations, and you shall be called the repairer of the breach, the restorer of streets to dwell in." I share this award with all the repairers of the breach out there, of all those who restore the streets to dwell in. I am humbled by this award, and from the bottom of my heart, to all of you who had anything to do with it, and to my children who cheered me on and still cheer me on for years and years, thank you.
Congratulations, Carmen. Well deserved.
Thank you.
We appreciate you. And at this time, I'm going to bring Michelle Mosley back. Thank you.
Yes, indeed. Congratulations to Carmen. We are so thrilled to have an opportunity to share in this award with you and for you. As Wilma mentioned, and Gloria mentioned, so well deserved. We want to just call your attention to a few other housekeeping tips for everyone. One of the things that you will need to do is to, again, use the Q&A if you have a question for us as we get into the rest of our program. We will also be adding links for you to access information and resources throughout today's program. So please keep your eye on those announcements that will be posted and coming out throughout the day. What I'm going to do is we're going to take a 2-minute pause, and then we're going to bring up our next speaker at 35.
The next session speaker is Dr. Kim Rhodes, Associate Director for Community Outreach and Engagement and Director of the Office of Community Engagement and founder of Umoja Health. To learn more about Dr. Rhodes, please review her bio in the Gathering program. Dr. Rhodes, please proceed. And thank you.
I thank you to all of you and to the Abundant Life Health Ministries Network, which I think is going to emerge in the next 15 years as a national model of how to sustain engagement and how to move an agenda on health disparities communities. So I just want to share a little bit about the Office of Community Engagement, and I want to thank the organizers for inviting me to make this brief presentation. So as many of you know, the Office of Community Engagement is an integral part of our comprehensive cancer center at UCSF. And we are lucky to be mandated to make sure that the research that comes out of our cancer center is relevant to real people's lives and is influenced by our community partners. We have a mission of trying to eliminate the inequities that drive cancer disparities in our catchment area. And we do that through four main pillars. The first is sustaining community engagement. And what we are trying to do is year-round and non-transactional. So yes, we're here focused on cancer, but we hope to help folks build capacity to do work in other spaces, because we know disparities are not limited to cancer. They cut across all disease types. We also facilitate academic and community partnerships, again, to make sure that our research is influenced by our community partners and that it is relevant to the needs that they are experiencing and expressing. And then we disseminate the research and the information, because there's really no point in doing the research and finding that certain communities are impacted and then not taking the time to make sure that those communities are aware. And then finally, we advocate for institutional policies that address structural racism, as well as the determinants of cancer outcomes. I'm sure you're familiar with most of our office staff. At one point or another, you may have had some touch points with them, but we have things kind of broken up into the community programming that we do, like the CAB 2 Chat and Chew. And then we have community education, which, as you know, is led by Michelle Mosley. And then we have a component that tries to partner up our community partners with our research enterprise. And I just want to take this time, take a moment right now at this 15th anniversary of the Great Gathering. I just can't stop saying congratulations, really, to the network, but I want to really acknowledge Michelle Mosley, who was introduced to me when I was at another institution as the best cancer educator in the state. And possibly in the country. And I have to endorse that label and moniker. And I think that you all probably feel the same, but Michelle is a force of nature, knows how to get a 2 for every time, knows how to meet the goals that sometimes that come from institutions, but also make sure that what we're delivering is actually relevant and that people care about what we're doing and want to be engaged with it and continue to participate. And I think that's evidence where we are today, sitting in this space right now. Our community advisory board was originated, as you've already heard, along with the Faith Communities Committee by our fearless visionary leader, Dr. Frank Staggers, to whom we owe a major debt of gratitude, and I personally can only hope that we are living up to his legacy. And in partnership with another visionary in cancer community engagement and education, Dr. Rena Pasek. And you've heard much of the story already. I also want to acknowledge Ms. Gloria Brown, the founding chair of the Faith Communities Committee in this. But our CAB is now 17 years old. And it is expanding, and we have good representation not only of different racial and ethnic backgrounds and interests, but also across geographies. Just to give a little bit of the structure, we do have the San Francisco Women's Cancer Network, which is also supported by a lot of the same visionaries that you heard about supporting Faith Communities Committee. We've got the Men's Health Committee led by Michael Shaw. And then I want to focus today on the Faith Communities Committee and acknowledge Ms. Wilma Batiste in her leadership in keeping it together, keeping things moving, and keeping folks on time. In addition to our community advisory board, I just think it's important for people to understand that the structure of our office is trying to shift the way institutions do partnership typically. Usually there's a partnership between one investigator and a community partner, and then that relationship relies on that one investigator sticking around in the long term, which is not a reality in academic life. And so what we're trying to do is be institutional partners so that our individual investigators can partner with communities, but then when it's time for them to move on, the community partner is not abandoned. They are still being held by our office and by the resources, linking them to the resources that we have to offer, not only in cancer, but throughout and across the campus at UCSF. So what that means is that we are also offering all of our resources, community health educators, support for community health fairs, our CAB2 Chat and Chew public forum, to the partners from SF CAN, to partners who are working with individual investigators, to our patient and family advisory council in the hospital, in the cancer center. And then during COVID, of course, we built out the Umoja Health Networks, of which the faith community partners have been a huge and strong component for advocacy and for delivering care and meeting the needs of our communities during this difficult time. And then we also have now a long COVID cab. And so I hope that folks will tap in with these resources to make sure that they get information. And again, it's non-transactional, so it doesn't have to be about cancer. It have to be related to a grant or a study. So that's what the office is doing, and that's what our structure is about. But now I want to talk about how the Faith Communities Committee has been involved in just about every program that the office has put on, but also that the Cancer Center, when it's trying to move an agenda in our catchment area and beyond, that the Faith Communities Committee and the Abundant Life Health Ministries Network members have been amazing partners and have enhanced the work and given us at UCSF a tremendous advantage in competing for some grants. So just mapping the work of the Faith Communities Committee onto our mission pillars. I'm going to talk a little bit about the mini grants program over time, and then about the academic partnerships, getting the word out about cancer and getting people screened, and then building up capacity for the network. So just want to start by acknowledging really, again, the visionary leadership of Dr. Staggers, Dr. Pasek, as well as Miss Gloria Brown in initiating the mini grants program. Up to this point, we have given out over $300,000 in mini grants, largely used to enhance the health ministries within our faith partners and within the network, not simply asking the partners to do a project, but trying to invest in a long-term commitment and long-term infrastructure that will help us get to this agenda on eliminating disparities. We also provided the grant writing training, which you heard about with the award with Miss Carmen Bogan, who is just absolutely amazing, an amazing teacher, amazing trainer, amazing communicator, and clearly effective because we trained 17 congregations in 2020. We would love to do this again. Of course, COVID has been a little bit of a problem because we did this in person, but of the proposals that were submitted, 70% or so were funded, and that amounted to more than $250,000 going to the various congregations, either in contracts or grants, some for cancer, but also some for COVID. I want to acknowledge that the network has really enhanced UCSF's portfolio of research and our ability to accomplish goals with those research efforts. So the Faith Communities Committee is represented on just about every community advisory that evolves within our cancer center. There has been integration of different community members into the teams that are doing the research, again, to continue to whisper in the ear of the investigators and influence the questions. And there have been multiple grants that have been, and this is something I think that is kind of hidden. But because we have this large network, and because all of you are willing to participate with our investigators, a number of grants have become more competitive for funding and have been able to receive funding through our ability to speak to building these partnerships and sustaining them over time. And that includes our community health educators funding, which we've had for 6 years in a row now. Not every cancer center has survived that long on this particular grant. And it is because of our ability to reach folks, and that ability is strongly facilitated by our faith community partners. I do want to point out, and perhaps Dr. Yerger, when she talks, will talk about the efforts in SF-CAN and the flavored tobacco ban in San Francisco, which is catalyzing changes across the country. I always like to point out the menthol-free Sundays and the organizing that happened within the faith community in San Francisco. I feel really moved this agenda on the ground. You can have lots of great ideas and research, but that doesn't change policy. Voters change policy. And the faith community really came out strong for this, and I think is underappreciated the role that the community played in moving this agenda. So I want to acknowledge that now. And then we are charged as a cancer center with reaching 25 counties across California, and that's a pretty big catchment area. And so I want to just really shout out the regional liaisons, and Miss Gloria Brown, your picture's in there. I know you're not operating as a liaison, but I know that you are always advocating for the growth of the network and the longevity of the network. But I do want to acknowledge Miss Batiste, Dr. Holder Jackson, Miss Marion Harris, Pastor Anna Dele, and Vonda Nolan for continuing to support new and evolving health ministries across the state. And so just to give you a sense of where they've been and what they've accomplished, and this is just the 2021 data, the liaisons reached and supported over 12 Bay Area counties, 97, nearly 100 congregations. And again, that was just last year's data. So I'm sure we're over 100 now. They're touching racially and ethnically diverse populations, and we are seeing an expansion and adaptation of the health ministries idea into the network of Pacific Islander churches, which includes 15 more churches. Hopefully some of them are on the call today. Just showing the commonality of the strength of building structure inside of congregations that can move any congregation, any denomination forward, especially as they try to address the health inequities and disparities facing their communities. I want to also, again, just shout out that our community health educators get a huge boost from this network, where we are able to participate and educate folks, where we're able to hold events, where the requests are coming from for us to be in particular spaces is really the foundation of it is Abundant Life Health Ministries Network. So in 2021 alone, we were able, despite the pandemic, able to conduct 175 cancer educational seminars, reaching more than 10,000 people. And then, of course, with the conversion of this conference onto online, we've still been able to reach more than 500 folks. And some of that is also facilitated by the fact that this is now recorded, so people can go back and watch it on video. Accomplishments could never have been achieved without the partnership of the networks, of the congregations, of the pastors who are committed to engaging in this way with us here at UCSF. So what's next? Another 15 years, hopefully. And what we hope to do is expand, obviously. As I mentioned, the Pacific Islander Church Network is adapting and expanding some of the tools that have come out Abundant. And now we are also starting to have some influence nationally. Michelle and I were invited to sit with the White House staff and HHS to talk about Abundant Life and try to help them understand how to do it and how to think about it and maybe how to approach. But we are also part of a larger network working on disparities, and there's a lot of faith partners in those networks. And so they've been invited. I hope some of them were able to get on today, but we know that we already have interest from a network in Chicago. So hopefully we'll be able to expand on a national basis. We want to catalyze the research that is relevant to the concerns of the network. And so we want to increase the potentially add some additional liaisons, but also start to embed our faith partners across the Cancer Center, not just in the research studies, but also into how our clinical trials are developed. We want to make sure that as we build out our portfolio at UCSF, that the studies are relevant to the people who are coming to our center. And so we're going to start to embed folks across a bit more of our enterprise. And then finally, we will work in the background to strengthen collaborations. And in particular, I really want to focus on increasing capacity for writing and getting grants. I would like to see the network members be able to really pull down big numbers, big dollars to do longer term programming and measure outcomes and impact on the health of the members of these different congregations. So I want to end here and just again provide my sincerest congratulations to the network and wish you another 15 years of success. And looking forward to working closely with you, especially as the conversation about developing a not-for-profit out of Abundant Life continues to evolve. To strengthen your ability to continue forward in perpetuity and to spread this word across the country so that others may participate in this effort to eliminate disparities in cancer and other chronic diseases. Thank you.
Well, thank you again, Dr. Rhodes. We're going to move forward with our program. We're going to go to Dr. Nainika Palmer with UCSF. Dr. Palmer, please proceed.
Good morning, everyone. Thank you for having me here today. I am going to talk about communication and its importance in enhancing your healthcare experience in cancer care. The first thing I want to share is that communication is truly the cornerstone of comprehensive cancer care. Communication has an impact on lots of different things across the healthcare system, including how a diagnosis is delivered, how treatment decisions are made, and it really is at the heart of the patient-provider interaction. And while much of my research deals with lots of different aspects actually of prostate cancer care in particular, I also do quite a bit of work in patient-provider communication. And a lot of my work actually deals with the research side of how we might improve patient-provider communication, and also how we might train providers, healthcare providers in improving or enhancing communication. But today, what I really want to arm you with, or information I'd like to arm you with, is really what you could do as patients in your own healthcare experience. So I'll first start by saying the single biggest problem in communication is the illusion that it has taken place. And what I mean by that is essentially we think that just because we learn to speak and communicate what we think is communicating with other people doesn't necessarily mean the communication has been clear across the board. And so what I'd like to talk about are some strategies and things that you can do and that you can suggest to your own communities and patients as they engage in a healthcare system. So first, what I always like to suggest is before your doctor's appointment is to make a few lists. What are your most important concerns? What do you want to have addressed in these appointments? What questions do you have? What is most important to you? You might also want to have a list of your current medications and the name of them, the dosage, what it's for, and actually how do you take them so that you can actually talk about that with your provider when you meet with them. Another big piece that may be important is your own medical history if the doctor isn't already familiar with your personal case. And then finally, who are your doctors? Having a list of who all of your doctors are is not just helpful for you, but for you to share with the other doctors you might be meeting with. And also your family is really important for them to know this as well. So before you actually embark on going to a doctor's appointment, the one thing I always suggest is that you ask someone to go with you. Having a second pair of eyes and ears can be very helpful, whether it be a trusted family member or friend. This can actually help alleviate some uneasiness that you might be experiencing, help decipher complicated information that could be shared, and most importantly, take notes. It's always great to have a helping hand in that matter. And before your doctor's appointment, it's also very important for you to bring everything that you need to actually read, hear, and talk with your doctors. So whether it be your glasses, a hearing aid, or someone to be with you to actually talk with your doctor. And once you get there, one thing I always do in the training that I do with healthcare providers is to have this process of introduction. So the first thing I always suggest is to introduce yourself. It's amazing to me that in these healthcare systems, doctors or healthcare providers don't always ask how you would prefer to be called. And so go ahead and introduce yourself and share the name that you prefer them to address you. Bring a notebook or something to actually record the note. And of course, if you're audio recording, you want to ask permission to make sure everyone in the room is comfortable with that. And then, of course, bring your list that we talked about already that includes your list of concerns and medications, etc. During your doctor's appointment, it's important to really share information that you have and your own perspective. So one, what is your agenda? So you have that list of concerns. Go ahead and be forthcoming and share with your doctor what's most important to you and how you'd like to prioritize the discussion in that appointment, whether it's talking about your medications or other medical history. The other thing is that's important to share for everyone in the room to know is what your expectations are. What do you hope to accomplish in this visit? All too often, we don't really think about this before we go to a doctor's appointment, but it's really helpful to give perspective and to ensure that everyone's on the same page moving forward. Like, this is your goal, you're sharing it with the physician or a provider that's there with you, and hopefully you all can move in the same direction. And then finally, sharing your experience. Perhaps you're facing a cancer diagnosis or have some concerns or worries, to go ahead and share that with your provider so that they're aware moving forward. And then during your doctor's appointments, you want to ask questions. All too often, I hear patients that I communicate with say, I just don't know what to ask. You know, I get in that moment and I'm just overwhelmed by a whole bunch of information and not sure what to ask. And you know, what I wanted to share here today is just some basic questions you can always keep on hand that's really applicable in a lot of different avenues or areas. For example, what tests do I need? What will the test show? Why are these tests important? How will this impact my life, whether it's a test, whether it's a diagnosis or a condition that you may have? What is the best way to explain this to my family? I love this question because it really helps the doctor to see, or for you to be able to talk to the doctor about how you might be understanding this information and how you might share this with your family and friends moving forward. It's kind of a check and balances to make sure everyone's on the same page and there truly is clear understanding between the patient and the provider. The other thing is, all too often, providers will say something or use medical jargon and things that just doesn't make sense. You know, it's okay to call them out on that and say, hey, you said such and such, what does that mean? And then the other, I always like to wrap everything up in a bow and, you know, and to really see, well, if other questions come up later, what's the best time to reach you, or what's the best way for me to follow up just in case I have questions after the fact? Now I want to guide your attention to specifically around prostate cancer. So many of you may know that I do prostate cancer work, and we recognize that there's a lot of complications in prostate cancer, or complicated information. And so one thing I always like to share with regards to prostate cancer specifically is questions around this that you might want to ask your doctor. So one, what kind of prostate cancer do you have and how aggressive is it? Essentially in prostate cancer, all prostate cancers are not created equal. There's different forms of prostate cancer, some that are very low risk or indolent, and others that are more aggressive and high risk that require a lot more care. And so you really want to see or know where you fall in that spectrum. What does your PSA, which is a blood test, and your Gleason score that you might have gotten from your pathology report or a biopsy, what do those scores mean? Having the doctor explain that to you. Is the cancer still inside the prostate, or has it spread outside? These are important factors to consider in a prostate cancer diagnosis specifically. What other tests do I need? Do I know, in order for me to know all of my treatment options? So usually what happens is when you get a prostate cancer diagnosis, one test the biopsy alone is not enough. Usually additional tests are needed to determine the extent of disease and what options are really available. And then the final question I always think is important is, what other doctor should I talk to consider my treatment options? It's never just one doctor you're dealing with in prostate cancer care. There's usually multiple doctors that you want to at least touch base with to ensure that you've considered all your possible options, which I'll go into a little bit later. During your doctor's appointments, you always also want to ask specific questions about your treatment options. So when you speak to a urologist, they're going to be talking about surgery. A radiation oncologist is a specialist in radiation, and so you want to make sure you talk to that person or someone in radiation oncology to get that perspective of radiation options. And then finally, the medical oncologist deals with hormone and chemotherapy that may be needed for more aggressive disease. So there's at least 3 providers you might want to touch base with given a prostate cancer diagnosis. Other important questions to ask are, what are the pros and cons in each of these treatment options? It's really important to have a full understanding of what might happen, whether immediate or longer term down the road. And then how will each of these treatment options impact me? What's the healing time? What kind of time off of work might be needed? What kind of home care needs might I require? And also what long-term side effects you might have. And then, of course, we also want to, this is always in the back of our minds. If you hear you have cancer, will it come back? Having those kind of discussions of having full disclosure about what to anticipate years down the road, perhaps. And then the other thing I would suggest, it's always a good idea to get a second opinion, particularly if you have concerns about not getting enough information. After your doctor's appointment, it's always a great idea to share your information with your support system, whether that be your family members and friends, people who may have experienced similar things, to actually help be a sounding board to what you're experiencing. You never should have to face this alone. And this is one thing I always tell the men that I work with in prostate cancer, is that you don't need to face this alone. There's resources that we have here within our networks that really require, going through this experience really requires a true support system. So seek that out. Have additional questions and need clarification, be sure to reach out to your doctor, whether it's through MyChart or a patient portal, an online system, actually send messages to your doctor, or maybe a phone call sufficient. And ensure that sometimes we might need to just set up a follow-up appointment just to ask more questions and to get more clarity if the first appointment was just too overwhelming or you might have missed something. It's always okay to ask for a follow-up appointment. And then finally, connecting with a support group has been a true resource for many men in prostate cancer in particular. And I know across all cancers that has been very helpful. And then finally, ask for help. We all need it, and it's important to reach out when we need help. So who is in your prostate cancer care team? I mentioned urology, radiation oncology, and let's not forget your primary care provider, your general internist, who kind of sees the bigger picture of everything. And then most importantly, as illustrated in these pictures, it's really our family and friends and our social support networks that are really a part of our healthcare team as well. It's not that one doctor needs to be leading this, but you are actually the driver of your healthcare, and everyone else is plays a supporting role, including the physicians that are helping to care for you. Thank you so much for your time. I'll be happy to answer questions when we get to that stage.
Thank you, Dr. Palmer. And if you would like additional information from Dr. Palmer, please go to our resource section on all of our speakers. At this time, I would like to introduce to you Dr. Valerie Yorger.
Hello, just give me a second here to pull up my screen. Okay, wonderful. So I just want to make sure that my slides are here and everyone can hear me fine. Okay, well, so let me get started by saying happy 15th anniversary to the gathering. I know that I've been invited several times in the past to speak about tobacco control, and I so appreciate having your ears and your support as we do this work. I'm the project director for the Loop. I am a professor at UC San Francisco. I am one of the original tobacco documents researchers, but for the past several years, I have been running a contract funded by the California Tobacco Control Program to address the inequities that currently exist in our state around tobacco control. Through my project, The Loop, we provide trainings and tailored assistance to help state-funded grantees, which include our public health departments and local organizations that are funded to do tobacco control. We have also been successful in getting the state to understand the importance of funding what we call our non-traditional partners. These are organizations that are not focused necessarily on tobacco control, but guess what? They are supporting, providing services to the very populations that are disproportionately burdened by tobacco. So having this partnership just makes a heck of a lot of sense, especially given that the state of California has identified the year of 2035 as our end game. What this means is that the state of California is preparing to end the use of tobacco in our state by the year 2035. And the concern that we have at this point, because 2035 is really right around the corner, is that many of us still have a lot of work to do within our own communities that are disproportionately targeted by the tobacco industry, that are disproportionately using these products. And yes, cessation is very important, but I'll talk a little bit about how we may need to think beyond cessation in order to help many of our marginalized groups to be prepared for this major policy that is coming to our state. So if we're going to be successful in getting rid of this tobacco epidemic, we're going to have to find ways to engage the various communities and the organizations that work within those communities to help communities be ready for it. For the Black community, this includes putting an end to the pervasive presence of the tobacco industry influence that is specifically within our communities and the availability of menthol cigarettes and other flavored tobacco products. One of the things that I haven't spoken about in my past presentations, and I just want to take a couple of seconds, or maybe a couple of minutes to talk about this, is the work that we did around the relationship between nicotine and melanin. I actually had come across tobacco industry documents that showed that the tobacco industry has been aware that those tissues that contain melanin accumulate nicotine. And I wanted to dig a little bit deeper into this to help provide some sort of insight to help us understand what one of the major causes are for the tobacco industry's presence in our community without disclosing this information. So what we know from a review of the literature, in addition to the tobacco industry documents, is that nicotine has an affinity for color. It accumulates in tissues that contain melanin, not only in our skin, but our hair. We have organs throughout our bodies that have melanin. Nicotine has been shown to accumulate in those tissues as well. And not only nicotine, but also tobacco-specific carcinogens have been shown to bind to melanin. And what we don't know is how long this accumulation stays within our bodies. The tobacco industry definitely had concerns about this relationship, even though they did not necessarily disclose it. So my colleague Ruth Malone and I, who's here also at UC San Francisco, she and I wrote a paper with this at least emergent hypothesis that we feel still needs to be considered, and that is, does the additional amounts of melanin in African Americans have something to do with our increased dependence on nicotine and our lower quit weight? So I just wanted to share that with you because I've not shared that in this and with this particular group in the past. So when we talk about tobacco in the African American community, we are really talking about the use of menthol cigarettes. And the issue with menthol is that it has this fresh, minty flavor that's very attractive, especially to our young people, whereas the tobacco flavor itself, the nicotine presence itself are very irritating and normally would make it very difficult for new uninitiated smokers to use these products regularly. So the tobacco industry uses menthol to to cover up the unpleasant taste of tobacco, but also to make the experience of smoking much more acceptable. And we also know that in addition to increasing smoking, it also, again, makes it very difficult for our regular smokers to quit. Information from the tobacco industry documents helps us to understand why the use of menthol cigarettes has increased tremendously among African American smokers. It's not because we're Black that we have this need or this love for menthol. It is because the tobacco industry has systematically taken advantage of the number of social inequities that we're dealing with to target a community that is constantly trying to deal with racial discrimination and other inequities that make it difficult for us to find a sense of purpose and wellness in our community. They have exploited this within our community and have not given us a break. So it's important for us to understand that we smoke menthol cigarettes because the tobacco industry has targeted us. This is just to show in comparison what the rate of menthol cigarette use is among other groups. Now, one of the things that has happened since my last presentation to this group is that there has been data. We now have, for the first time, data that shows the consequences of smoking menthol cigarettes amongst our African American communities between 1980 and 2018. What we've had in the past in terms of data have really been projections on what we foresee will happen in the future. But this particular research shows what has happened thus far. So what I'd like to do is just take a moment to share what is on this screen, because this is the take-home message here. When we look at the population of African Americans within the US, we represent approximately 12% of the population. If we look at the harm that is caused by the smoking of menthol cigarettes, and we look at it specifically to the African American population, this is what is highlighted in yellow. So if we look at the cumulative excess smoking initiation caused by the smoking of menthol cigarettes, we see among our population, we represent 15%. That's a little bit higher than our proportion of the US population. But if we go to the next column and we look at the cumulative excess deaths caused by the smoking of menthol cigarettes to the African American population, you see that we represent 41% of the harm. And if we look at the cumulative excess life years lost in comparison to the general population, we represent half. That is a huge burden on our community that is caused by menthol cigarettes. And we feel, as those of us who are working in tobacco control, and this gives me a perfect opportunity to give a shout out to the African American Tobacco Control Leadership Council, of which I am a founding member. We took it upon ourselves years ago to bring attention to the fact that this was a social injustice. And the work that we've been doing for the last 15 years, because some of us have been doing this for quite a while, is to help our communities to understand, yes, we have a number of health issues affecting us, but tobacco is the #1 killer of our people. And we have comprehensive menthol bans that are popping up across our state and even across our country that we feel is really low-hanging fruit to help us deal with this pernicious problem in our community so that we can then begin to start working on our community wellness and start dealing with all the number of other health and social and economic and educational inequities that we're facing. We need to sort of get our minds back here. And menthol is actually the vector that allows the nicotine to get in and take over our receptor sites in our brain that keep us from being able to be whole and well. Just very quickly, want to share with you, especially since Dr. Rhodes mentioned the work that we've been doing. We started really working to restrict the sale of menthol cigarettes in 2015 in the state of California. We followed Chicago. We had some input in how Chicago successfully did this. We followed doing the exact same thing that Chicago did in Berkeley. Yolo County up north was second to go. And we saw an opportunity to have some influence on local policies. It was Stan Glantz, who at the time was the director of the Center for Tobacco Control Research and Education here at UC San Francisco, who said, you guys are doing really great work. You need to bring it to San Francisco. We had an opportunity to do that through our Comprehensive Cancer Center, through the SF CAN initiative. And we came in 2017, we got the city of San Francisco to pass for the very first time a comprehensive menthol flavor ban. And what this was, it included menthol cigarettes, but it also included all the other tobacco, the flavored tobacco products, including the e-cigarettes. And I want you to see the faces of those who were involved. Here in a city where the African American population is roughly 4 or 5%, we took leadership of this. And yes, the tobacco industry came in, fought us, took the issue to the ballot. We won this in 2018 as the voters in San Francisco supported the work that we've done. And as a result of San Francisco, there are now 94 localities in California that have this similar comprehensive flavor ban. I want you to see the effect that we've had. And just in the past year, we have been successful in suing the FDA to get them to take this issue up at the federal level. The African American Tobacco Control Leadership Council was joined by Action on Smoking and Health in this lawsuit. The American Medical Association asked to join us in the lawsuit a couple of months later. And then later in that year, the National Medical Association asked to join. So we were successful in getting the FDA and their response to our lawsuit to consider a ban, a national ban on the manufacturing portion of these products where menthol cigarettes and other flavored tobacco products, specifically the flavored cigars, would be banned. The NAACP had a national statement showing their support for this. And I know that I'm out of time, but what I want to end with is that as we are doing these incredible policy implementations across the country and specifically in California, that we still need to deal with the demand for tobacco. We've been working on the supply side by focusing on the industry and their products, but we need to recognize that due to the amount of stress overload that we are dealing with, people are needing to self-medicate, and smoking is just one of the ways that we cope. So I will leave that because I know that we're going to have a speaker who's going to talk about the mental health aspects of this. So we need to do both. We also need to address the use because of people's need to take care of their stress. So I thank you for that, and I know that we'll have an opportunity for questions at the end. Am I still sharing my screen? I think I stopped sharing. Ooh.
All right. Thank you so much, Dr. Yerger. We appreciate that, and we'll be looking forward to chatting with you during the Q&A. And now we're going to move forward to our next speaker. We're going to have Ms. Gigi Crowder with NAMI, or the National Alliance on Mental Illness of Contra Costa County. And if you'll give me one moment, Ms. Gigi, I will bring up your slides.
Great, thank you so much for that. I also want to identify myself as the chair of the statewide Mental Health and Spirituality Initiative. For many years, we've known that when individuals are having a difficult time, they first turn to their faith community for support. And that's also true for people who live with mental health challenges. So we've been an initiative for the last 14 years advancing efforts to get our leaders to understand that this happens much more frequently in the African American community because of trust issues. African Americans feel much more comfortable talking through issues around stress, whether it be depression, anxiety, etc. And even those who live with more severe mental illnesses, they'd much rather talk to their faith leaders. And so I do see that the PowerPoint that I shared is not up quite yet. So I'll continue talking. And so I started my career looking for answers to help reduce disparities while working in Alameda County Behavioral Health Care. And I was charged with reducing disparities over 3 years for all ethnic and cultural communities that were considered to experience disparities. And I was like, oh my goodness, how am I going to be able to advance this effort? So I looked at who individuals identify as their cultural brokers and quickly learned again that individuals identify their faith community as the trusted, their faith leaders, their faith community as the trusted leaders. So some of you guys might recognize Dr. David Isom in Solano County, who is one of our mental health friendly community partners. And if we go to the next slide, I can share with you a little further why this work became so important. We did go through a difficult time through COVID. And so I was working with the statewide initiative to come up with some tools that I think would be helpful for anyone. And we came up with these wellness tips for ensuring that individuals could get through difficult times. When you're working for a county entity, or even the organization I now work for, NAMI, the National Alliance on Mental Illness, is the longest term grassroots organization in the nation with 600 affiliates. And so we do have a faith net. And I was asked to share some useful tips. And so these are what I came up with that was intentional for COVID and making sure that individuals could get through that very difficult time of being shut in place, but it's pretty applicable for everyday use. We're recognizing that some groups are having a more difficult time with readjusting or defining their new norm, but waking up in prayer. And I'm so blessed to work at an agency that allows for me to use the terminology that I use, prayer, blessing. I acknowledge that we should be reading our scripture. And then it was really important because of the isolation that was being caused for us to check in with family and friends, calling on the ones that might be having a difficult time. And because the suicide rates have increased dramatically for African Americans over the years, it's really important for us to also make sure that we're not discounting those who come across as strong and who have it together, because often we learn they are the ones that need support most. And if you have the option on your phone to do FaceTime, we know how important the eye connection, looking into someone's face and actually seeing them to assess how well they're doing. It's really important as we're having a heat wave, but there'll be a time probably in 3 or 4 months is already darker in the morning. So a lot of people who had a very active, I'm going to get up and walk before I go to work, are not getting up and walking because now it's dark at 6 o'clock, when just a couple of weeks ago it was still pretty light. So I ask people to open up all their curtains and bring in the light so that they have they get that vitamin D when you're out walking in the sun. And of course, we also have to use sunscreen, but it's really important to get out of bed. So many people I've worked with said that when they're having a difficult time, it's even hard to get out of bed. And it's really essential for people. I believe you need to do that because I think all of us need to be connected with our purpose daily, and having a plan for the day, of course, helps us with that. And it's also really helpful for people who know that they heal through music to cut on some music, some uplifting music that will speak to their spirit and help them. Showering and putting on fresh clothes, starting your day with brushing your teeth and combing your hair, even if you didn't have anywhere to go, it heightens our mental wellness. We should be drinking plenty of water. As always, we should always avoid heavy sugar and lean more toward fruits and vegetables. Most of us gained weight through COVID, and some of us are having a difficult time, me being one, taking it off because we went through a time of uncertainty, and that's the kind of space it puts you in, like, well, I might as well have this. And then spending time outside, I mentioned that. So we'll go on to the next slide, but anytime anyone is doing tips that their doctor, their therapist tells them to do, or their friends tell them to do, and they're not seeing an improvement, you should always definitely go get more support from trained clinical specialists in the field of mental health. And so the mental health friendly communities model, as I said earlier, was birthed, and we trained in each of the counties that you see here. And I've done some training across the nation on how to better support individuals when they're in a mental health crisis. I appreciate, and I think I get introduced and given an okay to do this work by Marian. So Marian Harris was doing the work in Contra Costa County, and I just kind of thought, oh, perhaps this could work also in Alameda County. And so I credit her for all of the efforts that we put in place around training faith communities on how to be mental health friendly. I'll go to the next slide. And we have some programs. So Mental Health 101 is to actually train faith communities about mental health, what it is, what it's not, and how they can more appropriately support someone, especially someone having what we call a mental health emergency. Then we have a training spirituality 101, and that's where we train faith. We train the important role faith plays for people who live with mental health challenges. And so we would not be as fully appreciated if we didn't share how, especially for the African-American community, the trust has been broken. And so we often hear in the mental health field, God is not a part of my healing. I don't think I can be healed. And that comes often from people. So training clinicians and mental health providers is important. There's a particular training that I focus on, which is I'm a winner, because I think every young person needs to have the opportunity to grow and thrive and believe that they can be successful. And so it's kind of a training that reminds them not just who they are, but whose they are. And this slogan I have, every kid needs an IEP. It's not an individualized educational plan, but it's an individualized empowerment plan. And that's in place to reduce the stigma associated with living with a mental health challenge. And then Keepers of the Flock is also a training for faith leaders that gives them an idea of their role as faith leaders in supporting individuals and their families when they've identified someone may potentially have a more severe mental illness, how the faith leader can support the family. And we use the parable of the lost sheep and how important that one lost sheep was. And then A Bridge Over Troubled Water, it kind of gives us an opportunity to historically look at the important role faith and spirituality has played for African Americans throughout its history, and how when we are in crisis, we always turn to our faith and spiritual practices for healing. And then what has become apparent because of what we've gone through, not just with COVID, but with the social unrest, is our faith leaders are now having a very difficult time. So we put together trainings on healing the healers, which is how do we support faith leaders who have probably had to bury more individuals in the last 2.5 years than any other time. So we're hoping that we are having quarterly retreats, and I actually got some funding from my county to do these retreats. And I have a partnering church, the Power Church, with Pastor Chris Williams, and we're just giving faith leaders a chance to come in with some clinical support staff, as well as other layperson who we call people with lived experience to lay down their burdens and get support because they're struggling as well. Next slide, please. And I won't spend a lot of time on this, but we did have to back up this work by doing surveys, and 90% of the county's behavioral health directors strongly agree that spirituality and faith is an important recovery resource for those who are in mental health treatment. It's important also around multicultural practices, whether you're African American, Latinx, Asian American, Pacific Islander. Your faith, and it's been tested and proven, is important to a holistic approach to healing. Next slide. I feel like I'm preaching to the choir because you guys already knew this and you've been doing the work for 15 years. So what is a mental health friendly faith or spiritual community? It's a local faith community committed to eliminating mental health stigma and improving outcomes for peers, that's people with personal lived experience, their family members, and the communities that surround them. So they include the knowledge about mental health in all of their ministries and programs. So when we have a health fair, we will do a screening for prostate cancer and other ailments. We also should be doing depression screenings and supporting individuals toward getting the tools they need to be more mentally stable and supported in the community without the stigma. Next slide. And I already shared this, but we couldn't do this work without also doing a survey for the peers, the people who live with it and their family members. And 88% of African-American, those who live with mental health and their family, said their faith and spirituality was important to them. Next slide, please. So we set out by having clergy roundtables, and some of the participant churches for your effort also are mental health friendly communities. I knew I needed the backing, so I always get proclamations from the Board of Supervisors. That's really important. So if anyone challenges, I can say leadership is supporting this. I always search for other allies. That mean people who are listened to by leaders who might not be from your community. And sometimes their voice carries more weight than individuals within the African-American community. And then we make connections with other like-minded agencies to make sure that we're not doing the work solo, as was the opening prayer said. Gigi Crowder can't do this work alone. She needs a village behind her to advance the efforts. And so I'm always looking for other opportunities to have partners. And when I was looking for, as I said earlier, where I can get the broadest support, I call it the power of the mic. So on a Sunday morning, when the faith leader delivers a message, if he's using the terminology that's appropriate around mental health, then we can make a lot of efforts toward reducing the stigma and educating our community about the importance of mental health, because we have the faith leader sharing the message, and that's the trusted vessel in our community. Next slide, please. And so you guys probably all know the disparities that exist in mental health, but a large part of the work and the mandate to have positions like ethnic services managers in each county was because of the 1999 Surgeon General's report. And sadly, it has not improved very much. As a matter of fact, even with new dollars in California through the mental health and the Mental Health Services Act dollars, which tax millionaires a half cents of sales tax, the issues for African Americans in particular have only gotten worse. African Americans too often get their services in the most restrictive environments, often while incarcerated, often being criminalized for living with what is, we know, a medical condition. So a lot of the work that I do is specific to removing and working with the DA, public defenders, and anyone responsible for caging individuals and not giving them the opportunity to heal through treatment in a safe environment, which is typically one in which they have individuals who are culturally responsive, culturally congruent, and look like them. That part is very important to a lot of people, that they have a reflection of themselves and when they're getting served. Next slide, please. We'll move on to the next slide if possible. So in Alameda County, while working there, we did a study called the African American Utilization Report. Some of you guys may have heard of it. Next slide. Its purpose was to identify the disparities and provide recommendations. And so we have those recommendations. Alameda County had the first African-American behavioral health director, and Dr. Mary Thomas. She did work closely as she could with Dr. Steigert, and had me attending some of the earlier groups that I believe they were held at Sutter in Oakland. And this was important to her, and she commissioned funding to the African-American community. And soon after that, she retired, and other things happened. So they're still working on it, but they're not where they should be in Alameda County. Next slide. So the issues that we addressed were the biases associated, and we know that the disparities are there because of, just as was spoken earlier, it's somewhat intentional. We provide a market for advancement. Even some of the funding that comes down, like full scope Medi-Cal, it targeted African-American children in the schools. So many kids who were not given permission to have a temporary setback, maybe due to a death in the family, a divorce, they were immediately put into special needs classes or labeled as having mental health challenges, which often leads to the school to prison pipeline. So we want to address that and make sure that individuals are not being cast off and have their spirits, I'll say, broken at a very young age. Next slide. We may skip through quite a few of these. Yes, we can skip through quite a few of these because I know time is limited. But we know that there's the landscape for African Americans as it relates to mental health is pretty bleak. It's only gotten worse. Co-occurring issues often happen because there's self-medicating that takes place in most communities, whether you live with a mental illness or not, is not more prevalent for African Americans, although the media shares it that way. And so I have seen my prompt that I must close out. So I'm going to skip all the way to the last page. And I just want us to focus on children and youth and reminding them that they're kings and queens. And I share with you on the very last page that my current efforts is making sure that every county has a African American holistic wellness hub. We have Native American health centers, we have Latinx, but we don't specifically have them for African Americans. And so we launched a campaign called 40 Voices in Contra Costa County, and they started with no way, we're not funding anything like that, to we're gonna study it. So that's progress. Thanks for having me here.
Thank you, Ms. Crowder. We will now move to Dr. Corinne Holder-Jackson for our Q&A period.
Hey, thank you, Michelle. I just printed our Q&A. All right, Dr. Yeager, one question is, can you tell us about the what's happening on the national and local front regarding the tobacco ban? We noticed that in the news there was a lawsuit brought against Juul for promoting the various flavors. Particularly our children love, our African American teens and young people love the flavors. And so we had a lawsuit against Juul. The news briefly told us about it, but I still see lots of young people still partaking in electronic tobacco. What's going on the local and national front?
Thank you, Dr. Holder-Jackson, for that. That's an excellent question. Normally I take an hour to talk about what's happening on the federal and the local fronts regarding this. Let me just be very clear. There has been some great responses from the community regarding the targeting of our young children by Juul, and it's not just Juul. They're now part of Big Tobacco because they have been bought by Altria, which is formerly Philip Morris. And one of the reasons why we've seen such great movement in terms of e-cigarettes is because when we look at who's smoking electronic cigarettes, they're predominantly white children. And the white parents and their advocates have been successful at getting a hearing on Juul and their targeting at the congressional level. Carol Magruder, who is on your community advisory board, who is also the co-chair of the African American Tobacco Control Leadership Council, she and I were at that hearing, and things moved very, very quickly. But when it comes to menthol cigarettes and banning those products, which predominantly are an issue for our community, it has taken many years. So although we're really happy to see what's been happening in terms of getting attention around the marketing of Juul cigarettes and seeing how Juul has been sued by a number of states, including our state of California. So all of that is very active right now. There's a heck of a lot of attention on it. There are policies within the state of California that we have implemented specifically on menthol cigarettes that have been inclusive of electronic cigarettes. So that is really the ideal ordinance is one that is inclusive of both menthol cigarettes, the flavored cigars and little cigarillos that our kids are smoking, as well as the flavored e-cigarettes. So we don't really want to see any sort of separation between what is happening with Juul and what's happening with menthol cigarettes. But in reality, we are seeing that there is a much more focused effort to reduce access of these electronic cigarettes. I just want to be very clear that we have to be inclusive of menthol cigarettes as well. When it comes to the tobacco industry's influence, they are very, very reliable, dependent. I was going to say they rely on, they're very dependent on our African American leaders. And that's what my research has shown, why they're so dependent on our leaders to disrupt the tobacco control efforts that are stemming from within our own communities. And we need to be clear of that. So very often when you have white policymakers trying to do good policy work, they kind of shy away when they feel that there's some sort of infighting happening within the African American community. And it's very difficult for a white policymaker to come up against the likes of a Black leader who's taking money from the tobacco industry to disrupt our work that we're doing at the community level. So very often we kind of get left out of policy work. So that's why it's so important for us to be educated, so important for us to understand what the real issues are, and to stand with those of us who have the evidence, who have been doing the work, who want to do what is best for our community, especially for our children. So I hope that kind of answered. I probably gave a little bit more than what you were looking for, but I wanted to take advantage of our Black leaders here today to understand. Joel, that's important, but let's not forget what we need to do around menthol cigarettes.
Absolutely. And so definitely there, I know that you answered this question for one of our participants, but is there a toolkit for health ministries that they can use to help with tobacco cessation?
We definitely have resources available. I put my email address in there, so anybody who's interested can contact me. I have actually spoken twice to the gathering about emotional brain training. I'm available to bring that, not only introduce it, but to show how to use those tools. I'm trained as a naturopathic doctor, so I appreciate, as I'm sure many of us do, that we have intrinsic feel-good hormones that we are designed to secrete. We have receptor sites in our brain to receive them. But when we are under stress and we have high levels of cortisol, we don't have access to those feel-good hormones. And there needs to be we need to talk about this, especially when we have tools to help us to lower our secretion of cortisol and to access those feel-good hormones so that we can have some joy in our lives, in spite of the craziness that's going on, that we have those moments of joy where we are not in fight, flight, survival mode, but can be creative and collaborate and talk about what is best for our communities in spite of the craziness that's going on, because it's us or no one to help us.
That's really true. That is true. Thank you, Dr. Yeager. All right, now for Dr. Palmer. Is there a checklist for patient-family communication tips that you shared?
There's not a particular checklist that comes to mind besides what I already shared, but I think, the biggest thing particularly around cancer diagnoses or facing cancer, It's to really try to get as much information as possible, not just from the physicians that you're speaking with, but social networks, support networks, like other people who have gone down that road prior to you. And because usually, you know, one of the things I always say, yes, I'm very familiar and a bit of an expert when it comes to prostate cancer awareness, but who more can be an expert than someone who's walked in those shoes? And so an African-American man who's been diagnosed with prostate cancer, and there's usually a lot of wealth of information that they can share more than I can, because I have not had that experience. And so I think it's about having conversations outside of the healthcare system as well. While there are experts within our healthcare systems, we as individuals and within our own healthcare experiences are also experts of our own health and our own bodies, our own experiences. And there's a lot that we can learn from each other. So one of the things one of my goals is to, within our community, change this paradigm of how we don't have a conversation about cancer diagnosis. For example, I didn't know that my grandfather died of prostate cancer until I told my family I was doing prostate cancer research. And so the fact that that didn't happen until then, you know, it's just kind of one example of how we don't talk about it enough. And also just not and recognizing that everybody's experience is different. And so just because one person had a horrible experience with radiation doesn't mean you will. And, you know, taking the good, the bad, and all of that together and just really getting a full perspective and not taking one perspective as the only option.
I like that. Thank you. All right. For Ms. Crowder, can you talk more? And this is from Tavi Baker. If not, or have you taught at Merritt University?
It was breaking up a little, but I think you asked me if I could talk a little bit more about the spirituality one-on-one training. Okay, so yeah, so most people don't recognize that most mental health programs started in faith communities, like when there was deinstitutionalization in California back in the 70s, 80s, that's the communities that came together. So we do a training that allows providers to understand the history of how we used to support individuals through the church, those who live with mental health. And it's almost like, you know, they need to go through mental health and the church needs to go through this marriage counseling to get back in sync with where we once were around the supportive factor. So the training we do for providers, we share that history. We talk about JCO and might be renamed, but we talk about all the fact that when a person goes into a hospital setting, the doctors ask them what their faith practice is. And so we want to move to a place where the providers understand that an individual may show up as their whole self, and part of their whole self is that they're a Christian, that they're Buddhist, that they have all of these tools that they carry within themselves as wellness tools that they want included in their faith practice. So when we do it specific to African Americans, we talk about historical practices that we use that the practitioner can't just say when a person is talking about their faith and how important it is to them. Okay, let's not talk about that. Let's just move on to your medication options, because that's going to shut the person down. They're going to be less likely to trust you and probably less compliant with the meds. And we know that medication is a big part of keeping a person in stability when they live with a mental health challenge.
Okay, so how can faith communities and community partners get the mental health friendly and other trainings that and resources that you mentioned? Are these, I love the trainings that you talked about, particularly with our youth. Are they trainer type of programs that can be distributed to our health ministry networks?
Yes, and Marian, as I said before, Harris has supported the effort. We've done the trainings at Glad Tidings. We target any effort that the church is experiencing. So we're coming out in the winter season, and so we always do one on SAD, seasonal affective disorder, and we help people understand the tools, as Dr. Yeager said, around the stressors and the feel-good hormones that sometimes elude our communities. And so we start looking at self-medicating. And a lot of times it's with cigarettes. People who live with mental illness have figured out, if I drink coffee with this cigarette, I get a high. But we know they're hurtful. And we know that people who live with mental illness die earlier, no matter what ethnicity they are. They die earlier than the general population, usually by 15 to 20. So we know that in the African-American community, that's like 30 years earlier. So we don't have a lot of people who live with severe mental illness who are older from our community, because they're dying in their 40s and 50s because the medication, there's not a lot of ethnopharmacology, and African Americans digest their psychiatric medication slowly. So a lot of times you see them over medicated with horrible symptoms like tardive dyskinesia, and they just don't want to take them.
Awesome. That's truly the truth. Okay. So then if we reach out to you, we can get more information and pass it on.
Yes, thanks.
Folks. Okay, so let me see. I have a few more questions here. Let's see. Oh, are there any holistic doctors in the Alameda area that any of you know of? And so I'm assuming that the person who asked this question, are we talking about mental health? Are we talking about physical health, or both?
I'll take a shot at that. So holistic means, to me, as a naturopathic doctor, it means a practitioner who is trained and willing to give you the space and the time to allow you to talk about what's going on physically, but also what's going on emotionally, mentally, and spiritually. For us, it is, when I say us, Black people, it is so important for us to be heard and for us to feel safe and to have the opportunity to build relationships. We already don't trust the medical system. We could be a Black doctor and they automatically will come in and not trust us because we're part of that system. It takes time, it takes an opportunity to build those relationships where people can start talking about what is causing them physical symptoms. We talk about stress. Stress is the cause behind 85 to 90% of what makes us sick. Including diabetes. We have an issue not just because we have sugar in the blood, but because we have high levels of cortisol. And the cortisol, when that's high, it has a direct impact on our ability to secrete insulin, which is what helps gets the sugar out of our blood. Now, here's something that a lot of us don't appreciate in terms of stress, which is something that I think is very basic, and that is we eat when we're under stress. Many of us will pick up something already, it's not going to be the best thing to eat because we're trying to feel good. So it's probably going to have a lot of fat, a lot of sugar. But when you're eating under stress, your digestive system isn't functioning because it's not a required function when we're in a fight flight mode. So we're not even digesting the food, and you have undigested food in your system, it's going to set you up for inflammatory conditions. So, if you want somebody who has that understanding, they don't need to be a naturopathic doctor. They just need to understand the role of all of these different realms on what we might go to a doctor to get help for, and that's a physical condition. We don't necessarily know when we have mental symptoms. We might, but all of that is very, very important in terms of our overall health.
Wow. Well, thank you for that. That's very interesting. Okay, for Dr. Rhodes, how can others get involved and partner with the Faith Committee and other programs at the Office of Community Engagement at UCSF?
Thank you for that question. The primary contacts, and we can throw the email in the chat, but we can be reached on at our email address. Will everybody be able to see it if we put it in the chat?
Yes.
Okay.
So I'm putting the email address in the chat where you can reach out to us at our office at UCSF. The leadership of the Faith Communities Committee, as you've already heard from, are right here in this circle. And that's where we would be referring that email to have some conversation about how folks can join. I don't know if what the parameters are, and I guess I would ask Ms. Wilma to comment on this. What are the parameters around folks or congregations that want to join that are outside of the state? Because I think that that really is kind of where we're headed in terms of trying to spread this concept of building long-term infrastructure and building capacity to address health issues. Ms. Wilma, do you care to comment on that?
That is a topic that we have been discussing within our liaisons in our group since the pandemic, and we are virtual and we are servicing people out of state. So we're looking to connect with a mainstream where we can bring these people in and it will fit. So we will get back to you with a specific answer, but that is something that's on our plate and we're trying to digest it the best way that's going to benefit us all. And continue to have your friends and families out of state join us, and that will make it move faster. Thank you.
I'm sorry, can I add one last thing, which is when you send the email address, let us know if you want to be, want us to reach out to you for our public community forums where we're sharing information about cancer, sometimes COVID, a lot about disparities and health equity. That's one way to just start to engage with our office and understand what the different offerings are as well.
Also on that same note, I'm sure our engagement with the FDA Black Family Cancer Network is causing us to have people from other states join in.
I have a question. How can I participate in the Faith Leaders Retreat about how to address tobacco usage from a spiritual perspective?
That sounds like a combination of the work I do with the work that Dr.
Yeager does, yeah. This person did not specifically say who, so both of you or one of you can answer that question.
So if I put my contact information and we're having quarterly retreats, I'm actually working on trying to find some funding to be able to have the faith leader just go off somewhere together in a beautiful resort and get massages and everything else they need, because I see the pressure on faith leaders. And so we've been doing them at a church, but we really need to have them separate and go out. And then I'm pretty sure Dr. Yeager can talk about the tobacco part.
I have quite a few faith leaders who contact me for their own personal help. And I find it very interesting that they all get and understand what it is to have a relief from the stress. And our ability to meditate, to pray, to connect with that spiritual side of us is something that we as a community know. And we know how to get there. As a matter of helping us stay there and to find our way there when we find ourselves very, very stressed out. And again, when we are in that sort of meditative, prayerful, joyful mode, we're not secreting cortisol. And that and so the whole emotional brain training that I've spoken about, and this will give me a chance to ask people to refer to Michelle, because I spoke to Michelle, I spoke at one of your events earlier this year, and you have a video of it. I think Dr. Rose had passed it around of me talking about emotional brain training, and it's something that you can look at your leisure. Feel free to contact Michelle or Dr. Rose if you want me to come and speak to your congregation about it. My frustration is that the introduction is just that. It's an introduction. It really requires following up and showing people how to use the skills. And I learned about emotional brain training right here at UC San Francisco, and the staff and faculty who are using it don't look like us. We need more of us doing it and more of us providing services as a provider to those of us who really need the work.
Absolutely. So Veronica Shepard has put forth a question: as a healthcare professional who works in the community, Black or disparities, what should holistic health actually look like for people experiencing constant stress and that's a question for each of you.
You kind of broke up for me while you were.
I'm sorry. As a healthcare professional who works in the community, African Americans are experiencing multiple stressors dealing with the social determinants of health on top of health disparities. What should holistic health actually look like for people experiencing constant stress and systemic racism, no matter what their economic background may be?
Yeah, sometimes we make everyone who's African American daily have an assault of self when they wake up, and it doesn't matter what income bracket they're in. So the idea around having holistic African American wellness hub would be that you can get a one-stop service, whether it be around tobacco, cancer, legal service, whatever, anything that puts you in that zone where you're not reaching for the candy, where you're not reaching, because most of us are self-medicating. Most of us are living with PTSD, post-traumatic stress disorder, because of what we experienced with COVID. And so acknowledging that and being in a safe place with other individuals who can openly, freely talk about what they're feeling is a part of the healing process in our community. And African Americans, because we're targeted and hit so often, I mean, I say, please don't watch the news. Like if you're watching the news, you're starting off, and it's going to take a while for you to get that good vitamin back into you, because you're starting off depleting yourself each morning. So that hub would just be, even for some people, just knowing it exists will be healing. Just knowing that their children can recognize that there's another way. If they're going into a classroom where they're being beaten down, they can go there and be uplifted. So, I mean, mine is all pretty natural. It's just us recognizing who we are as a people, and that we can heal each other from the head to the toe based on knowledge and scripture, really.
Can I add to that, if I may? Sorry, I don't want to consume all of the time, but I'm a member of Delta Sigma Theta Sorority Incorporated, as is Michelle. So Michelle has invited me to speak to her chapter about emotional brain training. Then another soror found out, so I've been sort of popping around to the chapters. Now the regional director is aware. I've been asked to talk about it at the regional level, because it's doable, it's free, it's very powerful, and it really addresses our getting out of one brain state where we do a lot of harm to ourselves and to others by what we say and actions that we take, to being in a place where we allow our thinking brain, which is the prefrontal cortex, to be in control in spite of it all. That's what we have to understand, that you can still find this peace of joy with crap happening all around you is so very necessary. It may take us several generations before we actually see any sort of improvement in the inequities that are facing us. But I tell you, we won't even start beginning to go in that direction if we continue to be spiraling downward and just being controlled by all the stress and cortisol that is in our lives. We see it on the freeway. We see you can't even accidentally touch somebody without them getting ready to go off. And that's not just because they're bad. It is because we are really stress overloaded and we are in survival modes, and we don't feel, because we're dealing with being threatened, and it doesn't even have to be a real threat. We are walking around perceiving a threat that doesn't necessarily have to be real, and that is no way for any of us to live.
No. So what I'm gathering from you is that you're telling us now that we must be intentional about what we're thinking.
You need the tools to
And
help you to get there. Thinking about
absolutely.
it is not going to help, because when you have high cortisol levels, you are not in a thinking mode.
Oh, no,
That's the whole point. You
no,
can't be intentional.
no. Well, I think that when we think about our faith leaders, I think now more than ever that we need to really hone in on those things, and we need to be our brother and sister's keeper. That when we're now doing our Bible study and our daily devotions, we really must do as the scriptures tell us to do.
Yes.
That these are the things that we're supposed to think about. The Apostle Paul tells us that whatever thing is good, whatever thing is lovely, whatever thing is of good report, think on these things. And when we think on those things and can share out those things on the blessing of the
That's
Lord,
helpful.
then it's
Yes.
very helpful. So thank you so much, Michelle. That's all the questions I can see, unless I look to see one more pop in. Dolores Hill says one thing that helped her through her mental health situations as a senior was having a pet to care for.
Mm-hmm. Oh.
Yeah, we actually have been promoting older adults. We talk about children have a failure to thrive. A lot of our older adults are not thriving because of COVID and being shut down. But what forces them to do it is if they have something to take care of, we heal through helping others, even if it's a pet. Like my mom personally, if I don't let her dog come with her, she's not coming. And it forced her to go walk, take care of the dog. And so she's more active than she was before. And I see her coming back. So that's perfect. Thanks for including that.
Yeah, I love that suggestion. It does help you get outside and exercise. It forces you because the dog can't stay inside. And it also helps you remain present. When another living being is requiring your attention, you have to remain present in that moment and be able to meet their needs. So thank you for that suggestion. That's awesome.
There's one more. Okay. Has anyone considered Nick Ortner's tapping technique to calm anxiety as a tool?
Dr. I have. I use it myself, but yes.
Okay, Michelle, that is all I have. Okay, now Michelle has asked me to ask each of you to give a 1-minute wrap up or a tip, starting with you, Dr. Rose.
This tip, I think, reflects on the last question about what can we do about the variety of problems that our communities are facing. And it reminds me of Baba Arnold Perkins, who is now our CAB chair, who often says, we are not outsmarted, we are out-organized. And I just want to say that I think that what we need to be doing, if we need to address multiple different issues, is we actually need to work together, and we need to ask each other, what can you bring to the table? And then try to leverage those different elements that can be brought to the table and have some understanding of like a referral pattern that goes through community. So we know where we can get mental health services, or we know someone who can do emotional brain training, like a quick mental health minute to bring down the temperature just a little bit. We know who we can reach to help people get jobs or find support. And I think I recognize this mostly out of the pandemic. It was very clear UCSF is not well versed in how to get food to people, but the faith community was already doing it and already knew how to do it. And so what we need to do is partner in ways where we're not overlapping on what each of us do, but instead linking each of the pieces together to get efficiencies and to reach the most people. So my tip is we need to organize.
Great tip. Thank you. Dr. Yeager.
Someone mentioned about teaching our children to be queens and kings, and I love that. There's not a lot of emphasis on how beautiful our Black and brown skin is and the power of melanin. There are many researchers around the world who come together in a research society. They call it pigment cell. They don't call it melanin. research. They call it pigment cell research. They don't look like us. They're trying to figure out how to create more of what we already have. And I would love for us to start talking more about how we have this intrinsic power within us and to start really appreciating it and helping us to understand that it not only makes us beautiful, but that it has very powerful emotional, spiritual, and even physical components. And what if I knew how important it was, and to just want to really honor it and take care of it. It will have a whole lot to do with how it is that I put certain products on my skin, what sort of chemicals I get exposed to, and what to do in terms of the food that I take in, and how it is that we just can come together. You know, Dr. Rose says to organize and to come together. That's something that is very powerful that we have an opportunity to really access and honor and give us common ground.
That's great. Dr. Palmer.
I'll just take it back to basics with kind of 2 points. One is no question is a dumb question. So any question that comes up, ask of it. Ask your physician, ask your provider. Don't be afraid to ask questions. I forgot which healthcare system it is, but they have a commercial where this young lady is asking the waiter a million questions about the food she wants to order. Then when she gets into the doctor's office, she has nothing to ask. And so just be prepared. I gave some strategies on which question, some questions that you could come up, but when things come up, write it down and take it to your doctor, and don't be afraid to advocate for yourself. That's my last point that I wanted to make, is that sometimes we have to speak up for ourselves when something doesn't feel right. And a lot of times we have to keep pushing until we get what we need. And so don't be afraid to advocate for yourself. And if that's not working, galvanize someone to help you with that, to help advocate for you as well.
Thank you. And Ms. Crowder.
Okay. I think it's very important to be unapologetic for advancing efforts for African Americans, asking for funding. I think when you start with the community that is most harmed, and I'm going to go out here and say, for me, it's African American males, and women get opportunity that they do not get. So they're the biggest threat. So they're the most harmed. And when we start with advocating and not biting our tongues and tasting our own blood, but being fearless about looking at the issues and taking it to the highest level of decision making to force the issues, and gathering individuals who will speak when your voice have been silent, because sometimes we'll go and we ask the wrong questions. When working in Alameda County, people used to say, we should ask for more money for Black people. They're spending money more on Black people than any, but it's inappropriate. So having the knowledge to understand that we need the money delivered in a way consistent with producing the best outcomes. African Americans trust their community more than they trust other systems. So give the funding to us, and then we will partner with the community that we trust most, which is the faith community. As Dr. Rhodes said, we have the church doing all this work for free. They feed, they help with mental health, they help with health-related issues, and then we don't want to fund them to do it because we'll pull out separation of church and state. But I've never been in any situation where I said, reach in your pocket and give me everything you have that says, in God we trust. No one's ever given me a penny, because we only use those type of barriers when we are trying to stall the progress that could be made for African Americans if we draw it on the strength we have in our faith community to solve the problems. And you guys have made great progress by doing that, but we haven't done it collectively enough to make a big difference. So Dr. Yeager is right. If we're decades away from what we could have in place if we just remember to go to scripture and do it the way God has already given us the script to do it. Thank you.
Thank you.
All right. Well, thank you, Dr. Corinne, Dr. Palmer, Dr. Yerger, Dr. Rhodes, Ms. Gigi Crowder. Thank you, everyone who had an opportunity to pose a question and have it answered either live or in the background. We certainly had a rich discussion. Now we'll turn it over for our next segment, Mr. Marion Harris.
Well, it's still morning. Good morning. I'm Marion Harris, and I'm the co-chair of the UCSF Faith Communities Committee and Abundant Life Health Ministry Network. And I am the health ministry leader at Glad Tidings International Church in Hayward. And I'm the moderator for this session. We have renamed this session the Pat Coleman Health Ministry Faith Community Panel in memory and honor of our sister, Pat Coleman. Pat passed away in 2019. One of her last health ministry tasks before her becoming ill was working with the gathering and serving on this panel. Let's take a look at a video to remember Pat Coleman.
St. Paul of the Shipwrecked Catholic Church was blessed the day Pat Coleman, a sister in Christ, walked through our doors and became a friend to so many. She was the founder and coordinator of our health ministry, a minister of Christian service, and an active minister and member of our parish family. Those who knew Pat loved her. She was truly God's child, called to care for and to heal the brokenhearted, the less fortunate, the downcast. A woman of deep faith, Pat's mission was to help those in need. She was a true and willing servant in every way, with so many wonderful endeavors she had done in the health field in San Francisco. It is with great joy, love, and admiration that we honor the life of Pat Coleman for her service to our community.
Thank you. Continuing with Pat's legacy of faith community work and ministry, we also want to pause to remember another health ministry leader, our sister Elizabeth Mack of St. Columba Church, Catholic Church, who passed away this year.
We're not seeing the PowerPoint there, Michelle. Maybe try again. Bring the PowerPoint up and then share it.
Thank you.
Perfect.
Thank you. Well, there are 4 key pillars to our program based on the Body and Soul program, which is an evidence-based program developed by the National Cancer Institute and the American Cancer Society. that supported health ministry development, sustainability, and was adopted by the Abundant Life Health Ministry Network in 2008. We continue this to the present, where we are working with faith communities. The pillars are: 1, pastoral support and involvement; 2, health education and awareness activities; 3, church policies and practices that support and promote health and wellness; and pillar 4, peer counseling and support to help with healthy behavior change. As faith communities and health ministry leaders, we all are so focused on doing what's right and doing our work, sometimes that we forget what we are doing well and what may be practices, best practices, and lessons learned. This session will share with you some highlights from churches' health ministry program that help more members in the community get health information and access to resources and services that are so greatly needed. Now, let's go to our panel, who will share health ministry's best practice and tips. Will be followed by video. Our panel consists of Dr. Jonathan Butler, who you met earlier in the program. He is a researcher, a health professional at UCSF, and a member and minister at the Third Baptist Church in San Francisco. Sister Carla Keena, who is a health ministry member of Allen Temple Baptist Church in Oakland, California. And Sister Deborah Roberts, a health ministry leader at the African Methodist Episcopal Community Church in Bay Point. Dr. Butler, will you start us out and share with us an example and outcomes from your faith community partnerships and the importance of pastor and ministerial support in the commitment to health ministries?
Thank you, Ms. Harris. And again, let me just say that I'm appreciative of the invitation to come and share with the group on today. As you mentioned, I am a minister of Third Baptist Church of San Francisco, and I first want to recognize our health ministry lead, Ms. Naya Ross. One of my other roles is the director of the San Francisco African American Faith-Based Coalition, with many of the Abundant Life Health Ministry churches are a part of. And so I want to start there. During the pandemic, actually prior to the pandemic, the coalition had a mission of feeding the hungry. And so since the pandemic, we were actually one of the only organizations, or the first organization, to begin feeding, because we had already established an infrastructure. And so the primary goal of this coalition is, first, we're about service and advocacy. We're about meeting the needs of the people, but most importantly, we're about collaboration, doing this work together, as I explained to you earlier in my remarks at the beginning. I think that's the most important thing that I can share with the group, is the power of collaboration. This is a collaboration of 21 churches whose main mission is really to eliminate health disparities through feeding. And since that time, since the pandemic started, we are at almost 700,000 meals that we've prepared for our community. We feed about 1,600 families, 2,300 individuals on a consistent basis every single week. And because of our collaborating, coming together, being able to feed people, which is a gateway to helping our community with other needs that they have, we've been able to not only do that, but we've hosted vaccination clinics and vaccinated and tested people on a regular basis. We've created a youth media team, a youth team, to help us to market to their peers. We've also included, an educational component to our program by providing music and tutoring free classes to students. And so not only are we interested in collaboration, which is a huge success, collaborating not only amongst the churches, but also amongst city agencies, collaborating with agencies like the San Francisco Marine Food Bank, Earls Organic, et cetera, UCSF. But we also are interested in further collaborations with other organizations. I think it's, again, the most important thing that I could ever say to you is the success that we've gained through working together. And I want to make sure that I emphasize that it has been a core value of ours, along with service and advocacy, but it's something that we pride ourselves in. And so one of the successes is bringing together these pastors who has been mentioned before, who's had to bury a lot of their members, who's been struggling with stress and trauma as a faith leader. One of the things that we've been able to do is give them a sense of relief. And from that relief, relief can take many forms. But one thing that has helped us is resources, money to be exact. And so because of our collaboration, it has strengthened our opportunities to gain or get money from private and public donors, which has helped us to sustain us to build an infrastructure that, again, gives some relief to our pastors. Being able to provide for their communities without them having to come out of pocket is a sense of relief for a lot of our pastors. So I'll stop there, but I wanted to make sure that I emphasize the importance of working together, because that's the only way that we can achieve success.
Thank you, Dr. Buckner. Sister Carla, will you tell us about Allen Temple's health ministry work, helping researchers learn about the diverse communities and your support in clinical trials education, and share some success and any tips that you might have for us?
Surely, and I want to say good morning to everyone and thank you to the organizers of this gathering and to join such a wonderful milestone event and an amazingly gifted and committed panel. I also bring you greetings from my church home, Allen Temple Baptist Church in Oakland, where Reverend Dr. Jacqueline A. Thompson is our senior pastor. Reverend Dr. Jaffer Smith Sr. is our pastor emeritus, and where I am a member of an incredible health education ministry led by our co-chairs, Deacon Harold Goodman and Nubia Esmeralda King. Before I talk about our ministry, I think it's important to provide context, because I think when Pastor Emeritus came to Allen Temple over 50 years ago, he came with an intentional, unapologetic paradigm of soul freedom and Black liberation theology. And so while, yes, he was concerned about our spiritual growth and development, he also thought it was important to deal with the nasty now and now, as he calls it, what was happening in our communities that was impacting his people, his congregation, and his community. So with that framework, all of our ministries, including the health education ministry, were formed to be very intentional and focused on looking at the ills that folks were having to deal with, not just on Sunday, but in every day. And so with that, we started to look at what kind of health information from a biblical perspective, but also a social construct, did we need to develop our health education ministry. So over 45 years ago, this ministry was born to do just that. And it started with Pastor Emeritus being an example of going to the gym, of exercising, of getting out, walking, even if you couldn't get to the gym, of taking care of your health information, like one of the speakers said before, of how you even engage with your physician, how you chose your physician, what you did when you got to that physician visit, so that every aspect of your health and well-being was something that we were concerned about. He also knew it was important to look at the skills and expertise we had in our congregation. So who are the folks sitting in the pew who could be resources to their fellow members? So doctors, nurses, nurse practitioners, physical therapists, whoever you had, we had resources right there in our congregation. So the first thing I would say is look among you and see who are people that might be wonderful resources, people that others know and trust that can be sources of good health information. And then it's looking at other partnerships, strategic partnerships, who in the community is already doing good work, like the Umojas, like the Roots, like the East Oakland and West Oakland health communities, clinics that you can call upon to help inform and shape the ministry. So with us and our strategic partnerships, we've been blessed not only with a really talented and experienced membership, we've also had the help of our health plans, like Kaiser is a very strategic partner. Other CBOs, we've had a longstanding partnership with Samuel Merritt University that not only provided us with clinical support, but also taught classes to some of our seniors and to provide faculty for our health education workshops that we would do every other month or so. One of the things that we also noticed is that our neighborhood in Deep East Oakland was changing. And again, saw the need to expand our outreach and our engagement. And so through our partnership with our Iglesia Bautista de Allen Temple, we're intentional in saying, come along with us. And even though there might be cultural and linguistic differences, our struggles were very similar in terms of disinvestment and marginalization in DP Stokely. So how could we come together and look at those issues and how they're impacting our health? And how does that influence our health education work? So another tip that we knew is that we had to be multifaceted and use different platforms, that we had to go where people were. So having Sunday morning worship again was wonderful, but sometimes people wouldn't come out to church or they couldn't stay, but we would offer services after church in between services. We offered workshops on Saturdays. As I said earlier, our seniors met during Tuesday or Thursday mornings. We do evenings, weekends. It's getting the information people needed to them when they needed it and having it be in language that they could understand, but also by people who look like them and that they could trust. And the church as a trusted messenger in their communities is important to be a place where people can come sometimes as their first responder role to talk to people about what's happening. We also expanded our vision because we knew that even when people did get to the doctor or sought out medical help, sometimes we would get there late because we would ignore some of our conditions, given all the other challenges we had to deal with. And we were seeing disproportionate impact and outcomes with health conditions. And one of those things was the kind of medications and the kind of research being done, because we aren't often considered or engaged in clinical trials and other research. And so a national organization called 50 Hoops, which is led by Ed and Pat Sanders, approached us several years ago. And because of our work in the community, wanted us to host programs at our church, which we did. One was on the multiple myeloma, and another was on amyloidosis. And because we were able to do that and engage with pharmaceutical companies and representatives, we're able to really give people the kind of information that they needed to help them be more aware and consider being in trials. Because as someone said, we are often reticent and skeptical about the medical community and the kind of drugs that are available. And so the more of us who are in these trials to inform the research and to make sure that there are pharmaceuticals and resources that really address our critical issues, I think the better. I think over the pandemic, we've had to all pivot, and that includes us. And one of our hallmark events every year is our annual holistic health fair, where we are on campus with sometimes upwards of 1,000 people on campus for a whole Saturday, where we offer screenings, classes, dance and music, yoga and meditation, backpacks and physical screenings for children, groceries and hot meals, clothing pantries, job workshops. We haven't been able to do that, but we were not deterred. And as you can see by my background, this year's health fair was just a month ago, where we talked about racism as a public health crisis. And we were intentional about framing it that way, because so often our people blame themselves or their conditions for where they find themselves. And we wanted to make sure they understood the structural conditions under which we're all laboring and how we have to attack that just as we're attacking our health issues. So I know I spoke really quickly because I wanted to stay within my time, but I think as we have these wonderful and critical conversations, and I think Dr. Rhodes talked about the issue of organizing, that we don't do this in siloed ways, that we reach out across the aisle, across communities and say, how are we doing what we're doing and how are we impacting our people? And what are successful ways in which we can engage, particularly in times when mental health issues are at an all-time high. Another thing that we've done, we have the SADA counseling on site, where we offer referrals and resources for people seeking mental health supports. So we have to be open and innovative in how we think about the issues that people bring to us, and meet them where they are, and not to be judgmental, and not to use what might have worked 20 years ago. We have to be in the moment, particularly with our millennials, and understand the language, understand the music, whatever vehicle we have to reach people and to embrace them, to make sure that their health and well-being are a paramount concern. So I end as I began, with an awareness of and commitment to ensuring that all we do is based in social activism framework that puts the needs of our congregation and people at the forefront of what we do to improve our health and well-being. Yes, prayer and scripture are vital to our existence, but so is knowledge and advocacy. So as the scripture tells us, faith without works is dead. I therefore thank you all for your good work as a tangible example of your faith. Thank you.
And thank you, Sister Carla. Sister Deborah, could you talk to us a little bit about the partnerships that your health ministry has established to share cancer-related information to your congregation and your community, and how you've helped people advocate for their health and lessons that you've learned?
Sure. First off, good morning to everyone, and thank you for inviting me to speak this morning. And congratulations to the Abundant Life Health Ministry. 15 years. I'm looking forward to 15 more years. I think the greatest partnership First AME Community Church established was in the beginning with John Muir Health Faith-Based Partnership. That initiative enabled us to organize our health ministry, open the door to become a member of the Abundant Life Health Ministry Network. And it's been approximately 13 years. Since the conception of the First AME Body and Soul Health Ministry, we have partnered with various organizations over the years, such as the American Cancer Society, UCSF, American Heart Association, American Diabetes Association, the Kidney Foundation, the Lupus Foundation, Parkinson's Disease Foundation, Contra Costa Health Services, Ethnic Health Institute, the Red Cross, and many, many more. Over the years, we have hosted health-related workshops and participated in various community events in Contra Costa, as well as other communities and counties. Sharing information related to various health issues, health disease, advocacy, prevention, reducing your risk factor for cancer, diabetes, high blood pressure, various health disparities that we as African Americans have faced over the years. Even addressing mental health, stress management, and key components to reduce your risk factor, such as knowing your numbers, reducing your blood pressure, reducing your sodium intake, reducing your sugar intake. Exercise 30 minutes a day, 5 days a week. If you can, try to get in 150 minutes. We also have stepped out of the normal comfort zone, I'll say, and looked at addressing some diseases that, health-related diseases that really don't come top on the radar, like lupus, like Parkinson's disease, kidney disease. And that has really enabled us to open the door and bring about discussions, and not just focusing on cancer, diabetes, and high blood pressure. At all of our events, the key component is sharing information to help to reduce your risk factors for cancer, high blood pressure, and diabetes, as well as other things. Nutrition and physical activity and your mental health and reducing your stress level or knowing how to manage your stress are key components that we need to utilize each and every day. Our events are open to the community. Our events are free. We try to collaborate and partner with those that are more knowledgeable or this is their field, so that they can bring that information and knowledge into our community, into our congregation, so they can get the answers to the questions that they need to be able to live a longer and healthier life. So many things are within our control that we need to control. And if you're smoking, stop. If you're not exercising, exercise. Limit your alcohol intake. Get regular screenings. As Dr. Palmer mentioned earlier, talk to your clinical provider, your doctor. Write it down. Take somebody with you when you're going on your doctor visits, so that if you're not getting in all the information, the person that you took with you can say, hey, ask them about such and such. If you have high blood pressure, document your numbers. Take them with you to the doctor. If you have high blood pressure, take your blood pressure every day, the same time, monitor it, and before doing so, relax. What I have learned over the years is that you can't do this mission by yourself. You have to collaborate with others in order to reach your goal. I've been blessed to be part of the Abundant Life Health Ministry over the years. And that partnership has opened doors for me to collaborate with other churches, other organizations, and other agencies to bring the information into the Bay Point, Pittsburgh community to help to change the lives of many people. Lessons learned. I guess before I do the lessons learned, one of my favorite annual event is our Pink Ribbon Tea. And it's an alternate celebration. 1 year is a tea, 1 year is a luncheon. That was all before COVID. We had to pivot. Now it's virtual. And we've been able to have some phenomenal speakers at these events. And some of the doctors, like Dr. Shol Ewing, some of her patients have came and attended, provided personal testimonies of their experience, their journey of dealing with breast cancer. What I have learned over the years is have faith, stay focused, don't give up, be flexible, meet people where they are, ask for help, ask for advice. You can't reach everyone, but if you can reach one, that has a domino effect. Learn from your mistakes and pivot when necessary. Build relationships, partnerships, and trust is a key. Try to reach as many people as you can and do it together. That's it, Miss Marion.
Well, thank you, Deborah. And thank you to all of our panelists. You have brought forth some information and guidance that will help all of our congregations move forward. Your tips and practices will just help us grow. Next, we have some video testimonies from other health ministries about their work and their best practices. Thank you all.
Greetings. My name is Vonda Nolan, and I am a member of the advisory board and also a committee member for UCSF Abundant Life. I have been involved with UCSF since 2007, and I'm a member of First Baptist Church and the liaison for the faith community churches in East Contra Costa County. The 15 years that I have been involved with the organization, I have encountered very supportive researchers and workers, and as such, reflect often on the awesome programs that we were involved in, such as the Breast Cancer Gene Education Program and the SF-CAN program that was launched to the community. And I really look forward to anything that we will be bringing out, because this is such an awesome group, and I'm energized. I'm just so energized as what we may come up in the future. Thank you.
Hi, I'm Marian Harris, and I'm the co-chair of the Abundant Life Health Ministry Network here at UCSF. I joined this work as I am passionate about eliminating inequities in healthcare and addressing the burden of cancer on minorities. This program has offered opportunities for involvement in community participatory research by my health ministry team. And we've learned a lot about the research project and why research is important to us. Looking back, I am pleased to report my faith community has made significant steps in embracing healthy lifestyle behaviors that can be traced back to our relationship with the Abundant Life Health Ministry Network. My fondest memory is of the choir using a salad bar as a fundraiser, and they were successful. Now we serve fresh salads at every meal.
Well, good morning again, everyone. As we get ready to wind down for the day, we want to take a moment to thank the Faith Communities Committee, the UCSF Office of Community Engagement staff, all of the presenters and speakers and partners, and you, our guests and attendees. Let me just go ahead and let you know that one of our speakers who was supposed to speak today, which was Dr. Cheryl Ewing, we were informed that Dr. Ewing had a family emergency, which resulted in her not being able to join us today. So we certainly extend our prayers forward to her and her family during this emergency period that they're facing. We also would like to take an opportunity to just to remind you that our session today has been recorded, and we look forward to making some edits and posting to the Marketplace of Resources area so that you may go back and review some of the topics, some of the information, the rich question and answer period and discussion at your leisure, as well as have you be able to share it with others. We also were behind the scenes taking note of who was in attendance. And so some of you will be hearing from us with surprises and prizes. So I do want to bring up just a quick slide here and acknowledge some of the folks who were able to contribute some gift cards for those of you who will be receiving those by email.
Maybe try opening that and then sharing. Let's try that again.
All right, try it again. How about now? Visible?
Looks good.
All right. So once again, we have the Marketplace of Resources link has been put in the chat for you to access, or you can access it here via our QR code, as well as the evaluation for today's program. We want to remind you and thank you and joining us in sharing with our award recipient, Carmen Bogan, for our excellent award for the Gloria Brown Visionary Award and the Wilma Batiste and Marion Harris Leadership Award. Congratulations again, Carmen. And we want to acknowledge again that we were behind the scenes spinning the wheel, and we'll be contacting some of you for a gift card. And the gift cards today have been donated by the Ethnic Health Institute of Samuel Merritt University. There will be 2 recipients of $25 gift cards, as well as Glad Tidings International Church Health and Wellness, 1 $25 gift card, and the Northern California Jurisdiction Women's Department, 1 $25 gift card, and then the Wisdom Study, a $50 gift card, and then a number of gift cards are also going to be awarded from our UCSF Office of Community Engagement. Please make sure, if you think you want to make sure that we have your correct email, we are using the email that you used to register. So if you want to make sure you didn't make a typo and that when we reach out, we reach you, we'll do that. You can go ahead and send an email to the symposium's email. So with that, we do have one more video to share, and then we are going to close out our time together for today.
Maloelele, my name is Amelia Tunakai Manuvahai. I'm from Tonga, and my family goes to the First Tongan United Methodist Church in San Bruno, which takes part in the Pacific Islander Health Ministry. We want to congratulate USCF Abundant Life Health Ministries Network on its 15th annual anniversary. We enjoy and are thankful for our membership with the Health Ministry Network and look forward to the continued partnership with the ministry. One event that the Pacific Islander Health Ministry hosted was a health fair we had in May. Here are a few photos to show how it went.
So I woke up early morning, decided to start my day, feeling good inside, so I'm walking with a smile upon my face. See, things just seem to be going well, today must be my day. I had no worries, not one at all, that words cannot explain. It's gonna be a good day after all. Started off on the other side, when it turned out to be just fine. It's gonna be a good day after all.
Comment.
Good afternoon, should I say still good morning? This has been a morning well spent. And I am grateful and honored to have all of my loved ones and friends here. I say that because you showed up. You have hung in with us for 15 years. Also, just to know that such community lovers and people as Assemblyman Matt Haney, Chief Bill Scott, Mayor London Breed, all of the many churches in all of the counties we serve, our friends over the many states and countries, thank you again, and we'll see you 2023 on the second Saturday of September. We love you and thank you. Keep us in your prayers.